Good evening. This is Dr. MJ Collier, and we are here coming to you for our Facebook Live presentation of Your Health is Important, the only interactive healthcare forum that allows you, the listener, to call in and ask your healthcare questions. So we're going to be talking about several topics this evening. The first, of course, the topic that's foremost on everyone's mind is the coronavirus. Where is it going? What is the Delta variant going to do? How should I conduct myself, etc. Then any other healthcare question or topic that you might have. So we have regular listeners that I'm hoping that will be tuning in. And as you ask your questions, we're going to be answering them live. I have one request, respectfully. When you give me a question, tell me who you are and where you're texting or calling from. So we'd like to know that so we can share that with everyone. Hello, Patricia Crawford. So glad to see you. It's been a while. We had some technical difficulties with our Facebook Live, but we're glad to have you participating. Hi, Shanika Banks. It's so glad to see you as well. Girl, I like that profile picture. And regulars, just call in, then answer questions, ask questions, etc. Let me start off by saying, everybody thought that the pandemic was over, that we were clear of COVID virus. Everybody was going back out, going to restaurants, movie theaters, gathering in groups again. And then what happened? The Delta variant popped and reared its ugly head. And because I think personally, my medical opinion is that we reduced restrictions too quickly, I actually said we probably should have gone at least another 2 to 4 weeks. But if we had followed suit with what was actually being proposed, which was that those individuals that had been completely immunized, i.e. their 2 weeks post immunization with the 2-dose Pfizer or Moderna vaccine or the 1-dose Johnson & Johnson vaccine. So those individuals were what I call super soldiers. They were immunized. They couldn't catch the coronavirus. They couldn't pass the coronavirus on to anyone. And I told you 6 months ago that there was no entity such as a carrier state. And once you had received your immunization and you had immune status confirmed, and I recommended that people get antibody testing, that was IgM, which is the 2-week short-term antibody that shows that you have responded appropriately, and IgG, which I call the great antibody, that gives you your permanent protection from infections such as influenza or the coronavirus. And once you have confirmed that you were a super soldier, that you could really conduct yourself any way that you like, you could go in groups, you could travel, you didn't have to wear a mask, etc., because you were protected. And because individuals did not follow the guidelines that were there for people who had not been vaccinated, now this is a pandemic of the unvaccinated. And so we're seeing two groups that are being disproportionately affected by the coronavirus Delta variant. One, children. One, because they have no vaccine available. Now, 2 days ago, the Pfizer vaccine was approved to go down to age 12. Previously it was age 18, then age 15, now down to age 12. So that covers your middle schools and your high school students. And I'm hoping that the teachers that are working in these environments and any other staff that is at the school, anybody from the cafeteria ladies to the principals to the janitors, everybody needs to have that vaccine, because that is a closed environment where the virus is already being demonstrated to be spreading. And so we have actually had staff members and students catch the coronavirus Delta variant, and we've had a few deaths just in the first week of school. So that shows you how serious we should take this pandemic. So with the Delta variant now being more easily transmitted, and when you do get sick with the Delta variant, the viral load, the amount of infection that you have in your body is greater. It's 1,000-fold higher than with the original type A coronavirus. So when you have that infection, you are going to be sicker. You're going to transmit it to more people. So you're putting your friends, your family, your co-workers, your children at risk. So Dr. Collier's recommendation, and please hear me loudly and clearly, get your vaccine. You can get it anywhere. No appointment is necessary. It doesn't cost anything. It is absolutely free, whether you have insurance or you're uninsured. The federal government is paying for it. All you have to do is walk in and ask for it. If you have insurance, they will accept your insurance gratefully. But if not, it's covered. So you don't have to feel shy about getting it. No one's doing you a favor. The funds have been allocated. It's available. So don't let finances be the reason that you don't get the vaccine for the coronavirus. Now, as I stated, there are 3 vaccines approved in the United States. There are 6 vaccines available currently around the world. But what's important is what's here in the U.S. And that, again, is the Moderna vaccine, the Pfizer vaccine, both 2 doses. One requires 2 doses 21 days apart or 3 weeks apart. The other 4 weeks apart. And then the Johnson & Johnson, which is the one and done. The one and done. There are differences in the vaccines, and I'll briefly elaborate on those. The Moderna and the Pfizer are what are called mRNA vaccines. The way that they work is there's a material that goes into your cells. It's a Trojan horse. It goes into your body's cells. It directs your body's genetic mechanisms to then make antibodies or proteins that are directly attracted to the spike proteins on the coronavirus. We've all seen the coronavirus models. It looks like it's a ball with cauliflowers all over it, or Brussels sprouts, all of those things, or broccoli sprouts. And so that's what it looks like. Those broccoli spears are called the spike proteins, and the antibodies attach at that spot. And so those 2 vaccines, by adopting the genetic mechanisms in your body, the things that create antibodies, they make your body make antibodies to that protein. Once that is done, they disappear. They do not change your genetics. They do not alter your DNA in any way, and they spontaneously dissolve within a few days of giving you that benefit. So you get all the benefit and no potential side effects or problems. Now, the Johnson & Johnson one and done vaccine is an adenovirus. It is actually a clone of a cold virus, the typical rhinovirus that causes colds, or adenovirus. And so they take that, they put a portion of the coronavirus in it. They generate this actually in monkeys, and then they purify it, of course, and then that's what you get. That exposes you to a portion of the coronavirus, not a disease-causing entity, nothing that can make you sick, and then your body protects yourself by making antibodies to it. So that's the facts about those particular vaccines. Now, all the vaccines have proven to be safe. There have been questions in women of childbearing age with the Johnson & Johnson vaccine because there's a high incidence or a higher incidence of blood clots, and these blood clots are in the brain. One, highly unusual. This just is not a phenomenon that happens regularly under most circumstances. And one of the things that happens when you get these clots is traditionally when you have a clot in your body, you treat it by using blood thinners to dissolve the clots. Well, this particular vaccine, at the same time that it causes the clotting, causes you to lose your platelet function and your ability to clot otherwise. So if you put on blood thinners and treat it the traditional way, it makes it worse. So we have learned this, again, by rote, because they were treating people with blood thinners and causing more problems and losing a few of them. And so they learned that that's not how you treat this. You have to treat it a totally and completely different way. Dr. Collier's recommendation is why I take chances on that, particularly since the highest incident is women of childbearing age. So they use the 18 to 35, but women, adolescents, once you start having a period, you have childbearing age. So I guess part of the issue at the time too was that the vaccine was not allocated to individuals younger than 18. So 18 to 35, childbearing age, at a higher risk. So it's recommended that they, quote, use caution in taking the Johnson & Johnson. Dr. Collier's personal medical opinion, once again, is to not take risks. Use one of the mRNA vaccines. I personally think that the Moderna is the most potent molecule and gives you higher immune responses. There were 2 studies that were released earlier this week that confirmed that, but both of them work well. If one is on a scale of 1 to 10, if one is a 10 and the other one is a 9, those are pretty good odds. I would take to Las Vegas anytime. So either one of those, again, whichever one is more readily available and you can get with the least amount of hassle while you're doing that. So remember, our broadcast is brought to you by Lipo Drops. We have our products, Lipobiotics, Lipoimmune, Doctor's Vitamin D, which is vitamin D3 at the prescribed dose of 5,000 international units that you take daily, and Lipo Omega. Those products boost your immune system and help your body fight infections that are viral, bacterial, and fungal. So to get your immune system boosted, go to our website. Don't do it now, but do it immediately after the broadcast, www.lipodrops.com, and find out how to boost your immune system. And remember, we have multiple pages with information about not just coronavirus, but also great health information, videos and slides that Dr. Collier have created to give you health information that you can trust. So we want to make sure that you're doing that. You're going to the website, go see those things that you can do. Remember, our original Lipo Drops is a weight loss product. So if you've been in quarantine and you put on your Corona 15 or your Corona 20 and you need to lose the muffin top with Lipo Drops. Our maximum formula, 10 times more potent than the original Lipo Drops formulation and results in greater weight loss. Now, how did this come about? When the formulation was first created, we saw that there was great success with it. So people that were taking it saw that they were having success. They concluded erroneously that if a little works, a lot would probably work better. So they were taking more, taking extra doses, and not being recommended and not recommended by Dr. Collier in any form or fashion. However, those individuals lost more weight. So cannot argue with clear science. This was clearly showing us that a higher potency product would result in greater weight loss. So after evaluating it, we came up with the Lipo Drops maximum formulation, which again gives you 10 times the amount of product and concentration of the amino acids that are in it that promote weight loss. And so try your Lipo Drops Max. But when you go to the website, there's an evaluation page that you take a small questionnaire, and it will recommend to you what products you need to obtain the objectives that you have. And so if you want to lose a little weight, a lot of weight, if you want to lose weight quickly, it recommends and leads you down that pathway. So go to lipodrops.com and pick up where you are. Now, I like to see where our callers calling from. Tune in, let me see who's watching, where you're from. Hello, LaShonda Nicholson from Dallas, Texas. Okay, I hope you listen to me on the Ricky Smiley Morning Show. We do our broadcast, our first segment, 6:45 a.m. Eastern Standard Time. So you can tune in, but we do prime time as well. Nikki Bentley, I like that as well, from Chicago, Chi-Town. So now we are Midwest and we're Southwest. So we want to see where we need some people from Florida, New York, St. Louis. Where are my listeners from California? We want to see you. Tuscaloosa, Alabama. Little Mama Carla. Good, little mama. Thank you for tuning in this evening. We are so glad that you're here. Don't hesitate to put your healthcare questions in because we're ready to go with those. Charlotte, North Carolina, Anthony Hardman, we got you there. Man, that's a great picture there. You look great in uniform, my friend, and we appreciate your service. We appreciate your service. Washington, D.C., Sheila Branch. Okay, Sheila, we got you in the house. If you have any healthcare questions about any medical topic, because Dr. Collier is your primary care physician, my traditional disease states that I treat, diabetes, high blood pressure, high cholesterol, disease states that disproportionately affect people of color, African Americans. So we're here to take care of you. Good evening, Jessica. Jessica Moore calling from Tennessee. Okay, now we got north, south, east, and west. We have the entire country crowded, showing up. So we are so glad that you have responded. Rosie Bland from Mobile, Alabama. She got her mask on in her profile picture too. Rosie, I'm so proud of you. Mobile, home of the original Mardi Gras. I see your Mardi Gras beads as well. So we know what you're doing. Travis Scott, California is listening. All right, Travis, we appreciate you. Is this the Travis Scott, the original or the real Travis Scott? Thank you so much for tuning in. Okay, Helen Pembroke, Pines, Florida. Helen Hines, we appreciate you as well. So I'll go some more health topics and you can tell me what you think. So let's talk about some of the myths that are associated with the coronavirus vaccines. And people are saying, oh, I don't want to take the vaccine. They developed it too quickly. Well, actually, the technology was developed over 15 years ago, and it has been fine-tuned up to this point. We have just not had a viral disease that we needed to use it for. So once the coronavirus presented itself, this technology was directed at this new viral entity. And what we found out was that it is very, very effective. This is going to literally change how we treat viral infections for my medical lifetime. Traditionally, we would tell people when you had a virus, oh, it's a virus. You can't treat it. You can't take antibiotics for it. You just have to get through the symptoms. And it'll take 10 to 14 days. That's the universal speech that doctors give patients. You don't need antibiotics. You got to get through the symptoms. It'll take 10 to 14 days. Treat your fever with Tylenol, Advil, or Aleve. Take cough syrup if you're coughing, etc. And hopefully your body's natural immune system would fight the fever. And then everything from chicken soup to you name it, hot toddies, people would try whatever they could to get through it. People seem to have a special affinity for products like Theraflu. I say because it's warm and you drink it like tea. I think that's why people like it, but I don't know. But people swear by it, and people have other products that they've been utilizing for viral disease entities. But now with these mRNA technology vaccines, we're going to find that we're going to be able to treat diseases like hepatitis, HIV, cancers. It's now been confirmed that most cancers are secondary to viral infections. Everything from Epstein-Barr virus, the herpes virus, HPV virus, etc. And so if you stop the viral infection or you direct your treatment at the virus, you can take care and eradicate the cancer without doing the damage that traditional radiation and chemotherapy does. And so people are getting now what I call the biological therapies for their cancers and seeing great results. So instead of being sick for 6 months while they're doing chemotherapy and losing their hair and losing their weight and just not being able to function and just not feeling good, these biologics can be directed to treat your cancers. And you just, it just treats the cancer. It does no substantive harm to the body. It just treats and cures the disease. So do your research. If you have a family member or if you yourself are dealing with a cancer diagnosis, there are places you can find this information. The traditional therapies are what are prevalent and predominant because that's what doctors have been trained to do. And so people and doctors will treat you for your disease state the way that they have been taught to treat you. So they have to be taught about this new technology and how to use it. If they don't know about it or not trained in it, they're not going to offer it to you. So you have to be your own health advocate and do your own research to find out. But you heard it here from Dr. MJ Collier. There are new and very effective treatments for cancers, including cancers that normally have really poor outcomes like pancreatic cancer. So if you want to see, or if you have a cancer diagnosis that needs to be treated, then take care of yourself, do your own research. Now, we talked about diabetes. There are new treatments out for diabetes that are absolutely incredible. There are drug classes called GLP-1 inhibitors. You've seen the commercials for them like Ozempic. You hear the song, Ozempic. Then they have 4 or 5 others that are in that class of GLP-1 inhibitors. What they do is they change the way your body metabolizes food in your stomach. And they always result in lower blood sugars. So if a person is diabetic, it lowers your blood sugar, lowers your hemoglobin A1C, but more importantly, it makes you lose weight. So because this particular product and this class of drug makes you lose weight, of course, the plan was to isolate the molecules so that you can use for weight loss, regardless of whether you were diabetic or not. That product is now available. It's called Wegovy. Wegovy is a once-a-week injection that you get. It will make you lose anywhere from 10 to 20% of your body weight in a very short period of time. And as of right now, the company that makes it, that is Novo Nordisk. Yes, Novo Nordisk. Novo Nordisk is the company. They are basically eating the cost of the product, and you can get it from if you get a prescription from your physician, you can get it for $25 a month for 6 months. And so most people will have lost all the weight they want to lose in that 6 month period before you have to determine whether the insurance company will cover it or not. So Wegovy, Wegovy, the newest, latest, greatest weight loss product that's out there, resulting in, so if you weigh 100 pounds, you can lose up to 20% down. So most of us are 200 pound range. So you should be able to lose anywhere from 20 to 40 pounds on this product. Again, once a week injection, hopefully with a reasonably simple diet when you're doing so. Can't have you eating Krispy Kreme donuts all day, every day, and drinking sugary drinks. But if you are maintaining a reasonably decent diet, you will lose phenomenal amounts of weight on this product. And so a lot of the other products that are out there in that class, the GLP-1s, people wanted, they weren't diabetic, but because they saw their diabetic friends losing so much weight, they were trying to get this product, and they would go in and say they were diabetic, etc. But now with Wegovy, you don't have to worry about that. It is an amazing product and one that's available. But again, the GLP, so if you're not diabetic, you can lose weight with the Wegovy. If you are diabetic, there are other products in that class, some injectable. There's even an oral medication now called Rybelsus. Dr. Collier started using this in his medical practice about 6 months ago. And again, phenomenal results. Makes you lose weight, but also lowers your blood sugar and lowers your hemoglobin A1C, which gives you a much greater and more stable state of health. Remember, when you lose weight, It's easier to control your blood pressure. It's easier to control your cholesterol. It's easier to control your blood sugar levels. Those three things, diabetes at the top, high blood pressure in the corner, high cholesterol in the other corner. That triangle creates a disease state called the metabolic syndrome. And if you have two of those diseases, you will always get the third. So if you have all three of them, diabetes, high blood pressure, high cholesterol, when you go to see your doctor, you have to make sure that each one of those disease entities is addressed at each visit. You don't want to say, well, today we're going to deal with your diabetes and we'll deal with your blood pressure next time, because you have to treat each entity together. You have to get them all controlled, or you get none of them controlled, or you get poor control of each. If you control all three of them, you'll have much easier to control in your lifestyle. It'll be like not having diabetes or not having high blood pressure. But if you have those things, you're at risk to die from the things that people die from. Number one cause of death, heart attacks and strokes in the United States of America, disproportionately affecting African American, people of color, next Hispanics. The darker your skin, the more affected you are. We got African American, Hispanic, American Indians, Asians, then Caucasians. As we lighten the spectrum as far as skin color is concerned, we find that the disease state affects us again stronger for whatever reason. And it could be genetics, it could be stress, it could be you're black living in America. All those things could be affecting you in a negative way. But the point being that, you are affected at a 300% higher rate. And so it's very important that when you have those diagnoses, you have to accept the diagnosis. You have to partner with your healthcare provider to treat your diagnosis in each of the disease entities. You can't say, well, I don't want to, I'm not going to claim it. I'm going to go in the healing line in church this Sunday and I'm going to take care of this. Or, I don't feel like taking medication. I don't want to take medication. I want to take natural supplements, etc. Dr. Collier is a strong proponent of natural supplements. I highly endorse them, but I always say these supplements are just that. They are in addition to and not instead of a prescribed medication that your physician has written that should give you a control of that disease state. So if you have high blood pressure, you can take apple cider vinegar and it'll drop your blood pressure 5 points. The problem is your blood pressure needs to drop 50 points. So dropping it 5 points is not going to help you. However, if you take your medication, which may drop it 20 points, you get 10 to 20 drops, 10 to 20 millimeters of mercury drop in your blood pressure with each drug that you use. So if you need to drop it 30 to 40 points, you're going to need more than one medication and you're going to need some supplements. So again, things like apple cider vinegar, black seed oil, noni juice, things that you read about and you hear about in the community and people are using and trying. No problem with those things. But again, these are in addition to, not instead of, and always, always, always check with your healthcare provider to make sure that they are complementary to whatever prescription medications that you're taking so that there's no conflict. How long do you have to wait to receive the vaccine after you were positive for COVID? Thank you, Manuela Bauer. You can get it almost immediately. I would say 2 weeks. They used to say 3 months. There was no scientific reason to do that. They just said that, I think, because they knew that people that had been infected would have natural immunity, and they were trying to save the vaccine for people who had not been infected. And so they were saying you needed to wait 90 days. No reason at all to do that. You could get it 2 weeks after you have recovered, which is about how long it would take you to recover. I would not hesitate. And understand, there's a medical truism. If you get the disease, you recuperate and recover from the disease, you will have natural immunity. But the question is now how long natural immunity will last. I think it will last up to a lifetime. But will it also impact the variants, particularly the Delta variant? That is being looked at and evaluated now. There's no reason that it shouldn't cover the Delta variant. But it hasn't been confirmed that it does. But what we do know, and what Dr. Collier is recommending, is that even if you have recovered from the disease state, you get the vaccination anyway. Because once you've gotten the vaccine, your immune response will be 300 to 500% higher than someone who's just using natural immunity to protect themselves. So no downside to doing that. You get that benefit actually from a single shot of any of them. But to be, quote, considered fully immune, you have to complete the regimen. You have to take both shots. You have to be 2 weeks past. That's what's going to give you your immunity passport, allow you to travel, allow you to go into places that are going to start requiring this. They want to have proof of vaccination, and one shot is not going to do it. Although in New York, they are accepting one shot as a reason or as a reasonable treatment option and allowing you to go into restaurants, movie theaters, spas, and gyms with just one injection. But again, the Johnson & Johnson is only one anyway. But if you're going to do that, I would recommend that you complete the regimen, get your card laminated. Laminate your card and take a picture of it and email it to yourself so you will always have it on the internet. So in case you can't find it, it gets torn up, lost, or whatever, you can always download it from the cloud, show it in any situation that you need to do so. And so you'll be able to continue your travels, go where you like to go. And remember, it's important that once you're out of the country, you need that information to get back into the country. So you don't want to go on vacation to Mexico or the Bahamas or Puerto Rico and then can't get back into the United States without them saying they want to put you in quarantine for 14 days. Most people would have some difficulty with their workplace in doing that. I couldn't take 2 weeks out of my office because of a faux pas of that nature. So again, if you're traveling, find out where you're traveling, what you need to do so that you can get out and so that you can get back in. But one thing I can state unequivocally, can I use Lipo Drops if I have epilepsy? Rara bear, yes, you can. There's no stimulants in the Lipo Drops. They are amino acids that are natural, and they will result in metabolism of fat. They don't have and should not cause any problems with any medications that you're taking for the epilepsy, and there should be no issues. If there's any questions or concerns, you can always consult your personal physician. But again, because the Lipo Drops have no stimulants, there's no problem if you have high blood pressure. There's no problem if you have diabetes. There's no problem if you have virtually any disease state in doing so. You should be able to take the Lipo Drops because it's just amino acids and B12. So you should have a good weight loss and you should have a good response to it, but you should not have any side effects. And it should be comparable or comparable with any prescription medication that you may be on. That was a great question, Rara. We love it. Tamika Owens, my job is forcing me, even though I've had COVID and had antibody T-cell testing that shows a level of immunity. I'm 245 days from testing positive for COVID. I still don't have my taste and smell back. I'm just so confused. Well, guess what, Tamika? One of the benefits that people have noted, particularly from the Moderna vaccine, is that they get the vaccine and they regain their sense of taste and smell. Right now, you're in a condition referred to as long COVID. And so this is a problem. You might benefit from the vaccine. You definitely would benefit from your immune response. But there have been multiple cases of people that had loss of taste and smell, even people with arthritis. They're not sure what the mechanism of action is, but you take the vaccine and those symptoms improve markedly or resolve totally. So don't be confused. You can get it. And if your job is forcing you to, then even though you've had COVID, I just spoke about the benefits of getting vaccinated even after you have had and recuperated from the coronavirus infection. So there's only great things for you. You've had the disease. You should not have any problems. One of the things Dr. Collier is recommending for people who are getting the vaccine, if you are concerned about potential side effects, you start taking the day before you get the vaccine a non-sedating antihistamine. There are 4 on the market: Zylol, Zyrtec, Allegra, and Claritin. Those are all 1 dose a day medications. I want you to take it for 3 days. The day before you get the vaccination, the day of the vaccination, and the day after the vaccination. I also want you to take an anti-inflammatory such as Motrin, Advil, or Aleve. That will give you great benefit as far as the inflammation, particularly at the injection site. So you shouldn't get the swelling. You shouldn't get the sore arm. If you do, it's going to be much muted compared to if you don't do these things. Now, there was a question originally, well, we're not sure you should take that. Wait until it gets sore and then take the anti-inflammatory. That made no medical sense. And then they say, well, maybe it might impact your body's immune response, so don't take it. That was not bared out to be true. They have found out that it's not the case. It does not impact your immune response in any way. But what it does impact is your side effect profile. So start taking the day before the non-sedating antihistamine, Zyrtec, Allegra, Zylol, Claritin, or their generic equivalents, and anti-inflammatory, Motrin, Advil, Aleve, not Tylenol. Tylenol is an antipyretic and a pain medication. It is not an anti-inflammatory. The problem with the side effect from the vaccine is one of inflammation. So you need to take an anti-inflammatory. So Tylenol is not going to help you in that situation. If you're having fever afterwards for whatever reason, you can take the Tylenol at that point. But you're going to get a better response with an anti-inflammatory such as the Motrin, Advil, or Aleve. So Tamika, I hope that answered your question, and I hope you can now get the vaccine with enthusiasm, because we want you to be healthy and safe. And if you don't, we want you to do that. Is Lipo Drops good for 60 and over? I sure hope so, Kathy, because lots of our patients meet that criteria. And if you go on the website and you look at our patients, we have real patient cases on there. These are people that have gotten on the product. You'll see some testimonials from people. These are real people that have lost phenomenal amounts of weight. And so they are, over 60 is great, because that is the age in which your body lacks those amino acids that are necessary to appropriately and easily metabolize fat. We all remember back when we were in our 20s, even possibly our 30s, and we had an event coming up, a wedding or a class reunion or something to that effect, and we said, well, I need to lose 10 pounds so I can fit into this outfit by the weekend. And you could do it literally drinking an extra glass of water a day. It didn't matter. You could lose weight on demand. And every decade, those levels go down and weight loss becomes much more difficult. It's been described as what's called the middle-age spread. It has nothing to do with being middle-aged. It has a lot to do with not having the appropriate amino acids in your body at the appropriate levels so that you can metabolize fat in an effective way. Because you can't do that, the fat starts to accumulate. And it's not much. Let's say it's 3 pounds, 5 pounds a year. That's not much until 10 years have gone by, and now you're 50 pounds overweight. So the Lipo Drops is very effective for individuals over 60. There are no age restrictions on Lipo Drops. So you can start taking it. We recommend 18 and older. There are adolescents that have tried it. We don't recommend it, but there's no real downside to doing so. But for 18 and above, no matter if you want to lose weight, you're going to lose the muffin top with the Lipo Drops. Great question, Kathy London. And I love that profile picture. Look like you either in church or at a fine dining experience. We appreciate that. Okay, questions. Do we need to give something to children as well before the vaccine? Absolutely. The same treatment regimen. Motrin, Advil, or Aleve. And the age groups that they have it down to age 12. Now, the children at age 12 are of enough size and weight, they can take the same dose as an adult would take. So that, and as well as a non-sedating antihistamine, all of them are safe in children. The children's dose is the same, so you should not have to lower it or cut the tablets in half or anything like that. That will give the children the same benefit. But we just haven't observed this in children a lot. They're just so active. They just don't do like adults do. So, but I would do it. I'm recommending it for everybody. Whenever I tell somebody to get the vaccination, I tell them to pre-medicate with those medications, and they'll be glad that they did. Those that don't, they say, oh, I forgot to take the medicine the day before. They want to try to catch up 2 days later. At that point, it still will help without question, but you could have prevented it. And the prevention means start taking it the day before, take it the day of the shot, and take it the day after. Remember, the antihistamines are all once daily dosing. The other medications, the Advil is 3 times per day, Motrin 3 times per day, every 8 hours. The Aleve is twice daily, every 12 hours. So again, 6 of the Aleve, 9 of the Advil or Motrin, 3 of the other medications. One family could buy 1 box of each. And let me tell you something, at the stores where everything is $1, at those stores where everything's $1, they have generic equivalents of these medications that are the exact same drug. So you could buy everything that you need for $3 to take care of your entire family, because most of the pill packs have at least 14 tablets in it. So if you're a family of 4, you can get to everybody 3 days worth of medications and you will be good. So at the stores where everything's $1, same medication. What should I do if I have diabetes and little protein in my urine and I'm on metformin and Jardiance? What else should I do? Lanice Sean Wilson, let me tell you, you're on a great treatment regimen now, the metformin and the Jardiance. Jardiance is a class of drug called SGLT2 inhibitors. That medication makes you urinate sugar. Well, not only are you urinating the sugar so that the sugar level in your blood goes down, you're also urinating the calories associated with that sugar. So being on Jardiance is another magic medication for diabetes that literally makes you lose weight. You don't have to do a single sit-up, push-up, or crunch. You don't have to join the gym. You start taking the Jardiance, you're going to lose weight. Now, metformin is, again, the #1 diabetes medication in the world. The common dosage is up to 2 grams per day or 2,000 milligrams. What I tell my patients, there's a medical model for treating diabetes that was started in Germany. And in that, they use 500 milligrams, only 500 of metformin, but you take it with each meal. In the United States, they have been using metformin either twice a day with breakfast and dinner, or you take up to 4 tablets at dinner time. Now, when you do that, there's a lot of complaints about GI upset and sometimes even diarrhea. But if you take the metformin at a dose of 500 milligrams with each meal, and the Jardiance, which comes in 10 milligrams or 25 milligrams, then that's a very effective treatment regimen. But if you need to add something, you can add the SGLT2 inhibitors, either the injectables like Ozempic, or the Wegovy, or the oral, the Rybelsus. The Rybelsus, starting off at a 3 milligram dose, not only will enhance the weight loss, it will lower your blood sugar and also allow your kidneys to heal. That's one of the benefits of the Jardiance as well. It's nephroprotective. In other words, it allows your kidneys to work and work wonderfully, and it improves renal function and helps cure the proteinuria. So you may find that after you've been on the Jardiance for a period of time, say 6 months, that the protein in your urine has cleared up because it protects and allows your kidneys to heal, which is amazing, because when the product was first developed, people shied away from it because they said, well, if it makes you urinate glucose, it's going to do damage to the kidneys, so we don't recommend it. This technology was actually developed in the 1960s, and it was poo-pooed away because we couldn't understand if you make people urinate and they have sugar in their urine, that was a bad sign for diabetes. So the professionals at that time, the physicians, particularly endocrinologists, did not embrace this class of drug. Come to the year 20,000, now we see that not only does medication not harm the kidneys, it actually improves renal function. And Jardiance has just been given an indication. Before, you couldn't give it if a person had more than mild kidney disease or proteinuria. Now they have decreased it to a glomerular filtration rate of less than 30, which is substantive and significant kidney disease, because it makes the kidneys better. There's also cardiovascular benefits with this entire class of drugs that helps prevent heart attacks and strokes and congestive heart failure and hospitalizations associated with congestive heart failure. So these are great. This is a great class of drugs, the Jardiance is. And so you're on a good regimen. Your doctor's taking good care of you. But ask about doing the metformin 500 milligrams 3 times per day. That could be life-changing for you. So good luck, Sean Wilson. We appreciate you tuning in. Thank you so much. Okay, Nigel Wall says, I'm worried about myocarditis, my 2 young boys, and the vaccine. I'm vaccinated, but what can you tell about young adolescent boys and the safety of the vaccine? Well, you're absolutely correct, Nigel, that in adolescent boys, they have found a higher incidence of myocarditis, which is inflammation of the heart tissue proper, the muscle of the heart. But what they have not found is any clinically significant myocarditis. For those that have actually had this as a side effect, most of the time the symptoms are resolved in 2 weeks. And if they have any symptoms, but during that period of time, they have not had to have their activities restricted. They have not had to do anything but get through the disease state or get through the immunization period of 2 weeks. And then they have found that in the vast majority, over 90% plus, that there's no problem, even if they do develop myocarditis. But the incidence in young adolescent boys is higher than it is in the general population. So you're absolutely correct to be concerned about it. I think that my recommended regimen of the anti-inflammatories, Motrin, Advil, or Aleve, will help prevent that as a side effect. That is just a scientific conjecture. I don't know that to be fact, but it makes common sense. And sometimes in medicine, you have to use common sense when you're thinking about it. So I would still recommend that they do that regardless. And they're at higher risk. This is a definitive. They're at much higher risk from catching the disease state coronavirus, particularly the Delta variant. As you see, we've had young people now that are dying from this disease state. Hospitals are full of young people that are on ventilators because of this disease state. So very important to, if you're looking at weighing your options, catching the disease, much higher risk of a poor outcome than the potential vaccine. So I recommend that you give it to them. Make sure that they do. The one that's been down to age 12 now is the Pfizer. I expect the Moderna to be available to the age group in the next week or so. I'm anemic. Billy Sue Combs, thank you very much. I'm anemic with high blood pressure, need to lose weight. Help. Well, if you're anemic, you need to take a multiple vitamin, a complete multiple vitamin with iron and minerals, such as one a day for women. You might have to take double the dose to build your blood count up. If you just have anemia, because most women of childbearing age do, because they lose more blood during their menstrual cycle, the 5 to 7 days that they have a menstrual cycle, than they replace with the foods that they eat. So most women of childbearing age, they go through menopause, boom, no more anemia. They get pregnant, no anemia. Why? The doctors put them on prenatal vitamins. I like prenatal vitamins because they give you the maximum dose of everything that you need in a vitamin. And they usually have something inside so it won't constipate you, because iron can be constipating in a lot of people. So one, take a product to treat your anemia. One, get your blood pressure under control. So losing weight will help with the blood pressure. It won't affect the anemia one way or the other. So you have to treat that as a separate disease entity. But get your blood pressure controlled. If it takes one medication, if it takes two medications, 5 medications, however many number of medications that it takes to get it under control is what you need. I have patients all the time that come to me and say, Dr. Collier, this doctor has me on 5 different medications just for my blood pressure. And after evaluating them, I see that each and every medicine is actually indicated. Sometimes I can cut down on the pill burden by giving people combination medications. There are blood pressure medicines that have up to 3 drugs in one pill. So I can take you from 5 to 2 pills, but I haven't changed your treatment regimen. I just changed the way that you're getting it. But it's we have changed in our philosophy in how to treat high blood pressure. This is how. Before, it was take a maximum dose of one medication. And only once you reach the maximum dose and the blood pressure was not controlled, would you reluctantly add a second drug. You would take that drug and titrate it, which means increasing the dose to a therapeutic dose or to its maximum dose, and reluctantly add a third dose if you needed to. So what we learned from that had a very poor control, because if a certain dose of medication is not going to control the blood pressure, increasing the dose only gives you about 7% more benefit. So doubling the dose of a medication doesn't necessarily improve its efficacy. So what we learned, that a little bit of medication that works in one way and a little bit of another medication that works another way, the combination of those 2, 3, 4, or 5 things at lower doses gives you much better control of your blood pressure, but doesn't cause imbalances in your body's chemistry that need to be fought against. So multi-drug therapy is the way to go for high blood pressure, sometimes for diabetes as well, but definitely for high blood pressure. I would recommend most people need at least 2 medications. They need what are called an ACE inhibitor, an ARB, an angiotensin receptor blocker, a calcium channel blocker, and a low dose of a diuretic such as hydrochlorothiazide. Those 2 or 3 things are the most common treatment regimens, and particularly the most effective in people of color, African Americans. Low dose diuretic therapy, and I say low dose because traditionally they would give people higher doses of diuretics, which would cause their potassium to go down, and they would have heart arrhythmias and usually die from a heart attack or a stroke that was basically caused by the medication they were taking being too high a dose and the low potassium. So what we found out, you get all the benefits of diuresis at a much lower dose without the possibility of lowering your potassium and causing a condition called hypokalemia, which means low potassium, by giving a lower dose of the diuretic and adding another medication to it. So we want to get you straight, Billy, to we'd be happy to take those recommendations to your primary care physician. If you're in and around the city of Atlanta, come see me. I'd be happy to see you. Dr. Collier is always taking new patients. Do I need the bundle? Sabrina Metley says, do I need the bundle, or can I use the Lipo Drops only to help lose weight? Well, weight loss is several things. 1, how much you want to lose. Number 2, how quickly you'd like to lose it. Number 3, obtaining those products in bundles sometimes. When you take the questionnaire and answer those questions, it will direct you and tell you what you need. So I tell people, it depends on how much you want to lose and how quickly you'd like to lose it. The Lipo Drops alone will result in weight loss. The Lipo Drops, in combination with some of the other products that are available on the website, particularly the Keto Max, Lipo Cleanse, probiotics, those things help effective weight loss in a variety of different mechanisms, and that combination will help always more so than the individual products. But the primary question that you ask is, can you use the Lipo Drops only to help lose weight? You can, you will, with just the Lipo Drops, particularly the Lipo Drops Max formula. But if you want to lose more quickly, then use a bundle of product with some of the other things that might be recommended depending upon your particular state and your desire and needs. If you're trying to get ready for a wedding before the end of the year, then you probably need to bundle. If you say, I just want to lose weight slowly and I gained it slowly, I want to lose it over time, then the Lipo Drops Max formula will probably give you all the benefit that you need. Great question, Sabrina. Thank you so very much. Christian KK Alexander. KK, thank you so much. What do children under the age of 12 do since the vaccine has not been cleared for that age group yet? Take supplements. I would, for those children, I would make sure those children are taking vitamin C. Make sure they're taking vitamin D at an appropriate dose for their size, which probably is at least 2,000 international units per day for a younger child. For someone, say, 6 or younger, maybe 1,000 milligrams of vitamin D. Supplements such as elderberry extract, zinc, which is available in even children's vitamins. Some of them have zinc. If not an individual zinc product, there are zinc lozenges that the children can take. They dissolve under the tongue. They taste good. I have some that are cherry flavored. I tried them. They're wonderful. So those things will boost your immune function and help protect you from getting bacterial, viral, and fungal infections. But they're going to have the vaccine lowered down to probably at least age 2, maybe even birth, probably by no later than the end of the year. But right now, children under 12, the highest age group, the highest risk age group now, because they're not vaccinated. And so they still need to follow masking. They still need to follow social distancing and cleaning of contact surfaces. Very difficult to do with a 12-year-old, but you got to be vigilant, mama. Let them know how important this is. Let them know how important this is, because we used to say, well, if children get it, fine. They'll get over it. Well, we'll find that's not the case. Children are dying from this disease state. Shirley Brown, I have itching at the injection site for over a week. Is that normal? Of course, that's not normal, but it is a reaction that you're having. You need to take a non-sedating antihistamine. I think the best one when you have itchy skin is Allegra, Allegra. It used to be prescription. It is now over the counter at its prescription strength of 180 milligrams. I would take one in the morning, one in the evening, roughly 12 hours apart the first day. And then after that, one a day after that. Also make sure that the skin at the site is not dry. You could put some topical 1% hydrocortisone cream, also available at the store where everything is $1. You can get the generic version of the Allegra and some 1% hydrocortisone cream and give yourself symptomatic relief within 24 hours. I would keep using it for at least a week, and hopefully that will totally and completely resolve. So great question, Shirley. Thank you so much for tuning in. We appreciate you. Any in the queue? Okay, Charlene Curtis says, I took only one shot of the Pfizer vaccine in April because it made me sick for weeks. Well, it probably won't happen with the second shot, but it could. But if you do what I just recommended, taking the anti-inflammatory and the non-sedating antihistamine starting the day before the shot, that will be muted. I can promise you. Can't guarantee it, but I'm pretty sure that won't be the case. And you took it in April, you still can get the next dose. They have found that you can take the second dose up to 3 months out, and probably longer, without having to start the regimen over. So no problem. Jocelyn Scott asking, am I accepting new patients? Yes, I am, all day, every day. You can go to my office website, Atlanta West Primary Care. I'm located one exit west of Six Flags Over Georgia Amusement Park off of I-20 at I-20 and Thornton Road here in the suburbs of Atlanta in a city called Lithia Springs. But I'm one exit west of Six Flags Over Georgia Amusement Park, 15 minutes from downtown Atlanta, so not too far to drive under any circumstances. I have people that fly in to see me from Florida, Miami, Colorado, California. So, no distance is too far. We see anybody who'd like to be seen, and we'd be happy to accept you. Joshua, you call the office. The phone number is 770-948-5400. 770-948-5400. Say you saw me on Facebook Live and you'd like to come in and be a new patient, and we'll get you into the office as quickly as possible. But we're taking new patients all day, every day. Connie Lorraine says, I had a stroke in 2018 that left a small blood clot on my brain. I'm terrified to get the vaccine. I know Johnson & Johnson is out, but how do I feel the Moderna is safer for me? Absolutely. The clot on your brain is not in your brain. The clotting that is associated with the vaccines is inside the arteries because it causes inflammation of the cells that line the arteries. Those cells are like tile in your bathroom or tile on your floor. They line every artery in your body. They're called endothelial cells. Those cells get inflamed and cause clotting on a microscopic level inside arteries. Well, what you have is a clot outside of the brain. That's from a bleed. That blood, that bleed happened. The blood clotted. It sometimes will liquefy and dissolve over time. It may take months. It may take years. So they may still be able to see it on CT scans, or they may be able to see some residual at this point. But I think that you probably would be safe to get the vaccine, I highly recommend the Moderna. I think it's just the most potent with the fewer side effects and gives you a greater immune response. So go get that vaccine and check back with me when we do Facebook Live in 2 weeks. I want to know how you did, Connie. We wanted you to be healthy. I can state this unequivocally. If you do get infected with the corona, particularly this Delta variant, it's going to cause greater risk of inflammation and problems with clotting. You've heard of COVID fingers and COVID toes. That's where the small clots cut off the circulation distally, the further away you get from the heart, and blood function and cellular function on the cellular level is compromised. That is why people are having heart attacks and strokes from the coronavirus infection. So very important that you do that. But that is a great question. But always, 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 I tell people always check with your primary care physician or your neurologist, whoever's taking care of this problem, and see what they suggest and if there's a reason that it will be contraindicated. Okay. Michelle DeWalt. Okay. If fully vaccinated, do we take supplements to fight out the variant? Yes. Dr. Collier takes his supplements every day. I take the probiotics. I take the Doctor's D. We also have a product called Lipo Immune that has multiple things in it. It's got zinc, it's got vitamin C, and it's got elderberry extract. Those things are all combined, one, to decrease your pill burden. Because even myself, I found out that taking 5 or 6 pills every morning is a problem. It's hard to do. And so I would wake up in the morning, wash my face, take a pill, brush my teeth, take a pill, take a shower, take a pill, use the toilet, take a pill, spreading them out 5-10 minutes apart, taking about 4 ounces of water with each. But even so, it's still not enough things that I do in the morning and not enough time to get it done. So that's the easiest way to do it. You definitely could take all of them at one time. I would recommend, once you take more than 3 pills, that you take 2 full glasses of water. That does 2 things. It dissolves the tablet quickly, gets it out of your stomach and into your system. Because if you just wet the tablet, it will sit on your stomach and form a gummy residue that can sit there for hours. And, and hours later, you can still taste it. You're burping it up, and it can even make you feel nauseated. That's with anything from aspirin to vitamins. So make sure Dr. Collier's pearl for the day is when you take any medication that you take a full glass of water, and it will be in and out of your stomach within a mere minutes, up to 2 minutes. If you like to test this theory, get 2 glasses of water, fill one up about an inch, and put 1 pill of there, any type. The other one fill to the top. Put 1 pill in there. You don't have to stir it. You don't have to shake it. Just let them sit there, and you'll see that within 2 minutes, the full glass of water, the pill will have dissolved, and in the other one, it will not. That's just physics, and that's just what most pills are now. It's very rare these days that you have to take medication with food. It's rarely a requirement. Some things are absorbed better with food, like our vitamin D product, Doctor's D. Because it is a fatty liquid, it is absorbed better with food. So is the omega-3 fish oil, but I take them all the time without eating, because oftentimes I can't eat breakfast in the morning because I'm rushing, but I will take them and no problem. They absorb, they work. It just is absorbed better and works better if you take it with food. But there's rarely medications on the market, prescription or supplements, that require you to eat to take that prescription. If you drink enough water, you're good. You're covered. No problem. All right. Sheila Branch says, fortunately, I do not have high blood pressure, high cholesterol, or diabetes. However, for the month of July 2021, after finishing a 30-day fast, I noticed a rise of 7-pound weight gain. My diet was mostly salads and water during that time. What could be going on? You have protein deficiency, so your body is retaining fluids, and that's water weight. Once you start back eating, you should rapidly lose that. You'll notice that you're urinating a lot, urinating frequently. You might be afraid that you have diabetes because of that, but it's not that. You just have protein deficiency because doing salads and water. Not a good idea for a fast. You have to make sure you get your protein in, because if your body is not taking in protein, if you're not eating it, it will get it from where it needs to get it from, which is your muscles. So you will note that you lose muscle mass, muscle density, and you start to lose your muscle definition, because you're literally losing muscle. And muscle weight is heavier than the weight from fat. So as you lose muscle weight, you're gaining fat and you're retaining the fluids. So once you stop doing that, and you said July, so now you're hopefully eating again, that should reverse itself in the next week or so. So make sure you're getting enough protein in, chicken, fish, beef, even pork, Not recommending pork, but hey, some people like it. Go ahead. But just protein, whatever sources you can find. You need real protein, meat-based protein versus plant-based protein, because you're in a protein deficit state. And so you need the real type of protein that will help build muscle. All right, Sheila, good luck. Jacinta White, please, how soon after having COVID can you get vaccinated? Please help. MJ, those are my initials, MJ Collier. How about that? I love that. Now, again, you can get it up to 2 weeks after you have been diagnosed. Day one is the first day you were diagnosed with the COVID test. So if you had a positive test, that's day one. 14 days later, you can get the vaccine. No problem, no concerns. It will give you immunity and boost your natural immunity that you have from already having had the coronavirus infection and recuperating from it. You're going to have now 300 to 500% higher immune response. So yes, go get it. I will get the 2 doses. Why is it that COVID boosted my blood pressure and I caught it last year? As of June, I have been fully vaccinated with Pfizer vaccine, yet my blood pressure is still high. I'm not diabetic either. Cuddy, I don't think that the vaccine caused your blood pressure to go up. I think that's coincidence. There's been no cases of people getting high blood pressure from getting the vaccine. I think you just have high blood pressure. If you've had it now for quite a while, as of June, you say your blood pressure is still high, you need to have that blood pressure treated effectively. And over time, you may find that you can come off medications, but right now, high blood pressure, which results in heart attacks and strokes, are what kill Black people, particularly African-American men dying from heart attacks and strokes. So take a diagnosis of high blood pressure seriously. There used to be 5 stages of high blood pressure. Now there are only 2, stage 1 and stage 2. Why? Because once you're at stage 2, it can't get any worse. You're at no higher risk for a heart attack or a stroke than you are in stage 3, 4s, and 5s. So a very simple and elegant thing to do: control the blood pressure so you don't become diabetic, and so that you don't get high cholesterol, and take care of your health. We are reluctant to embrace that diagnosis, but if you have it, you have it. It's what it is. You need to treat it so that you can improve your health. It will literally add 10 to 15 years to your life. You won't have a heart attack, won't have a stroke, won't have other side effects like erectile dysfunction. Are there any side effects of Lipo Drops? The Lipo Drops, again, are just natural amino acids. You should not have any side effects from them. Again, unless you're allergic to one of the fillers or possibly even the food coloring that's in it, you should not have any issues with it. But it has no stimulants, so it's compatible with any disease state and any prescription medication that you could be on. Okay, Tam Scorpio's finest West. Oh, I love that, Tam. Oh, been having palpitations lately and been to the ER to see no problem. My doctor appointment is so far away and I feel short of breath. Also, even though my oxygen is good. What could I do with palpitations to my appointment? I don't want to go to the ER again, but I'm scared. Well, sounds like you might be getting overstimulated. I hope you're not a person that's drinking a lot of coffee, particularly those that that you can buy on the corner store that are $4 or $5 per cup. That has 300% higher caffeine in it, which is why everybody craves it and people will stand in line for an hour to get it. But stimulants such as caffeine, it can even be teas. It can be something else that you're eating or drinking that can be stimulating you. Even drinking a lot of sugary sodas with caffeine in them can cause you to have that problem. So decrease the amount of stimulants, particularly caffeine that you have, and you take a low dose aspirin, 81 milligrams per day, to protect your heart and see if that helps with palpitations. But hopefully someone's done blood work on you to make sure that your potassium is okay. You say your oxygen is good. This actually could not be palpitations. Your heart may be fine. It may be what they are calling panic. And so that needs to be evaluated. But form a partnership. Don't go to the ER. Do not get your health care in the ER. ER is for life-threatening emergencies. That's what emergency room is. You need to form a good relationship with a primary care provider in this situation who may or may not refer you to a cardiologist. It may not be that kind of a problem, but to evaluate you and form a team that takes care of you and your health and keeps you healthy. That's what we want to do, and that's what we need to do. We need to form a good team with our healthcare provider to keep us healthy, so that we're not doing intermittent care based on crisis situations. There should be rare occasions where you have to go to urgent care, and even rare occasions that you have to go to the emergency room. One, the cost of emergency room care is very, very expensive. It's 10 times the cost of going anyplace else. And 2, they don't rarely do anything. Once they find out that you're not dying, they stabilize you and tell you to follow up with somebody else. Oftentimes not even addressing the complaint that you came into the emergency room with, because they say, well, your vital signs stable, your EKG is normal, you're not dying. We don't know why you're having palpitations. See you next time. So no, that's not the place to go, but you should be concerned, but not scared. So come back to DEFCON 5, woosah, relax, and then make an appointment with your primary care provider, not your GYN. GYNs do not deal with this problem, and waist down healthcare is not comprehensive healthcare. You need a primary care provider that's going to do what we call waist up and evaluate your vital signs, your blood pressure, etc. Great question, Tam. Scorpio spinus. We got you. Adrian Sewell, best treatment for neuropathy in the feet. Neuropathy can be caused by a variety of things, and it can manifest itself by symptoms such as a pins and needles sensation, numbness, or even pain, or even a burning sensation like your feet are on fire. It can reach that entire spectrum. That can be sometimes caused by vitamin deficiencies, but most oftentimes is associated with disease states such as high blood pressure or diabetes. So there are medications particularly indicated for that. There's one called Neurontin or gabapentin that is very effective at that. There's another one called Lyrica that is now covered by the vast majority of insurance companies. It's once or twice daily dosing, and it will give you some relief as well. But you need to try to figure out the etiology of the neuropathy. But if you have that word in your vocabulary, that means you probably have been seen by a healthcare provider and they diagnosed the neuropathy as the symptom. It is not a disease state. This is a symptom. The question is, why do you have the neuropathy? And let's say if it's due to diabetes, then you control your blood sugar, get your diabetes under control, and magically the neuropathy is no longer there because it is a symptom of the primary disease state, which again, it could be cardiovascular. You could have what's called atherosclerotic cardiovascular disease or peripheral vascular disease, which means you have poor circulation in your arteries and or veins. All that can be evaluated by a vascular surgeon or a vascular specialist to determine if that's indeed your case. It may be something as simple as an ultrasound of your lower extremities to determine if you've had that. Okay, so Jocelyn Cook, last question, and thank you so much for tuning in to the Your Health is Important radio broadcast coming to you on Facebook Live, brought to you by Lipo Drops. Go to the website, lipodrops.com, www.lipodrops.com to find out how you can attain better health and boost your immune system. I had Guillain-Barré syndrome in 2000. That is an ascending paralysis for people who are not familiar with that. And they have found that this vaccine and many other vaccines, including tetanus and hepatitis vaccines, etc., have resulted in people getting Guillain-Barré syndrome because it is an autoimmune response. You're activating the immune system, so you could get Guillain-Barré as a side effect. No one has had permanent symptoms. Usually this is self-defeating. It resolves spontaneously in 2 weeks, 4 weeks at the most. Most of the time it's much less than that. So Johnson, you should be concerned. I would consult with your neurologist or your healthcare provider. I would also take to heart what I told you about taking the non-sedating antihistamine and the anti-inflammatory to minimize the chances of that happening. But I definitely recommend, because people that have gotten infected with the coronavirus have had problems with Guillain-Barré syndrome. So the disease state itself can cause this problem, and you could have that as a side effect in an entity. With this new Delta variant, it's more potent, higher viral loads, and much more severe infections. So I'd recommend that you are a person that has comorbid conditions that put you at risk, and I recommend that you get the vaccine as well, but always in consultation with your primary care physician or your neurologist. This brings to a close this episode of the Ask the Doctor segment. Welcome to Your Health is Important. We'll see you next time on Facebook Live. Thank you so much for tuning in.